So may I introduce Dr. Dann Del Mundo, the project leader of Project iWas. Associate Professor Dann Del Mundo is the Department Chair of Food Science and Chemistry of the University of the Philippines, Mindanao. She is also faculty staff of the Philippine Genome Center, Mindanao. She's a graduate of Bachelor of Science in Food Technology in UP Visayas, Master's of Environmental Science with an area of specialization in Environmental Chemistry and Toxicology in UPLB, and PhD in Food Technology in Suranari University of Technology in Thailand. Her researches include food safety and water quality. She is a project leader of a DOST-funded project, iWas, which stands for Integrated Wastewater-based Epidemiology and Data Analytics for Community-Level Pathogen Surveillance and Genetic Tracking. It is now a proof of concept.
Good afternoon, everyone. This afternoon, I'm going to share with you our research journey in wastewater-based epidemiology. So starting with this presentation entitled Stool Tool Wastewater-based Epidemiology. So as mentioned earlier by Dr. Caro, so in March 2020, the WHO declared that the coronavirus outbreak is a pandemic. So through this declaration, public health surveillance systems were immediately instituted to reduce the transmission of COVID-19. So for example, in the Philippines, shortly after the declaration, the government imposed community quarantine in Metro Manila. That is to contain coronavirus. But unfortunately, the coronavirus still spread in the other regions. So for example, shortly after that one, in Davao City, the former Mayor Sara Duterte declared Davao City under quarantine, and she expressed through the Executive Order 10 that there is a need immediately to be aggressive and proactive on the impending spread of COVID-19. And she emphasized that, noting that there are limited testing kits and results take too long to become available. So as you can observe, COVID-19 surveillance in the Philippines relies heavily on RT-PCR-based clinical diagnostics of symptomatic individuals in their contacts. However, this has a lot of challenges. For example, it has limitation in the early detection or prediction of community outbreaks. It is logistically demanding, and also it is expensive. So there must be another tool for COVID-19 surveillance. So as you can see, there is a trend, especially in other countries. They use WBE, or wastewater-based epidemiology, in COVID-19 surveillance. So studies have shown that SARS-CoV RNA is shed in the feces of symptomatic and asymptomatic individuals with COVID-19. So with this, WBE can be a complementary tool for COVID-19 surveillance, since it is based on the premise that wastewater represents a snapshot of the status of public health of a certain community. So actually, COVID-19 paved the way for wastewater-based epidemiology. Over 70 countries have already started to use WBE in their COVID-19 surveillance. However, these countries have wastewater treatment plants. Now, this is a challenge in the Philippines because most of our cities and other places in the Philippines don't have a centralized waste treatment system. However, we still want to try this one. Maybe it has a potential in the Philippines, and we started it in Davao City as our pilot study area. So in June 2020, we submitted a proposal in UP Mindanao, of course, with the team of Ma'am Caro, Ma'am Murao and Ma'am Otero and the rest of the team. So we had this pilot investigation of SARS-CoV-2 wastewater-based surveillance in Davao City. So the main objective of our pilot study is to employ wastewater-based epidemiology and whole genome sequencing as approaches for COVID-19 surveillance in low resource and no sanitation barangays in Davao City. So as a methodology, so we coordinated with the CHO and the barangay, and we identified creeks and sewer pipes as part of our sampling sites. So these areas, we had 6 barangays initially. These areas have been classified that time by the CHO as low, moderate to high risk of COVID-19 transmission. So our sampling period was from November to December 2020. So from the wastewater sample, we processed them, and then we tried to detect, or we detected, or we checked the presence or absence of the virus. And then with the positive detection, we process it again for whole genome sequencing to check the mutations. So for our results, as you can see, SARS-CoV RNA was detected even if the wastewater were classified as having low risk of COVID-19 transmission and were reported to have no new cases. So this suggests that SARS-CoV RNA detected in community wastewater may come from pre-symptomatic, asymptomatic, or symptomatic individuals who did not self-report to their local monitoring unit. So another highlight of our pilot study is this result. Pilot genomic surveillance to wastewater confirmed the presence of previously reported mutations while identifying mutations not yet registered in clinical surveillance. So this was already discussed by Dr. Caro. So we found the existing mutations, and we also detected mutations that were not yet reported that time. So this means that wastewater genomic surveillance can facilitate the early detection of mutations using lesser resources, because we are using the wastewater, which represents the pool of individuals for our study. So as a conclusion, the detection of SARS-CoV RNA in barangay wastewater in Davao City indicate that WBE and WGS can be a practical complementary health surveillance tool for COVID-19. And the detection of SARS-CoV-2 RNA in barangays with low risk of COVID-19 transmissions signifies the potential of WBE for unbiased reporting of COVID-19 infections. The last one, WBE can generate trends in the community transmission of COVID-19, while WGS can identify mutations that may impact public health interventions. So because of our pilot study, or from our pilot study, we identified some challenges. So this is the absence or lack of centralized wastewater treatment facilities. So remember, as I've said, the other countries which are using WBE as a COVID-19 surveillance tool, they have a wastewater treatment plant. But that is lacking in the Philippines. Well, specifically in Davao City, we not all, or some areas really have no wastewater management treatment system. So we also found out that there is a complete data on sewer pipe networks in the community. So why is this important? Because the sewer pipe networks is very important in tracing the contributors of the virus. So we need to establish that one. The next one is the contribution of the physical, chemical, hydrologic, and anthropogenic factors to the SARS-CoV RNA recovery. So we need to know what are the effects of the temperature, the dissolved oxygen, and all those other environmental factors, and even anthropogenic activities to the SARS-CoV RNA recovery. So you can find more information regarding our pilot study through our published paper. And because of these challenges that we found in our pilot study, our team has expanded from in-house project to a bigger project, the iWas project. This is a project under the program DIWA that is funded by the DOST NICER. So we'd like to acknowledge this institution and for our funding support. Daghang salamat.